Thank you, Chair. It's nice to see Minister Michel again. Minister Diab, welcome to the committee. My questions are from Minister Diab, and they're regarding the Interim Federal Health Program. So it's my understanding that the cost of this program has ballooned about 30% year over year to $900 million. And this program covers asylum claimants. It is also my understanding that the number of asylum claimants covered by this program has increased to 440,000 from about 350,000 last year. So some questions regarding this. Do you anticipate that this number is going to go up, the 900 million that we're spending on this program and the 440,000 asylum claimants next year?
Excuse me, I would like to clarify, Minister. Let's be sure this relates to the study, Mr. Strauss, and
this
not
is the interim
just an immigration question. Thank you.
Yes, this has to do with asylum claimants being covered. Like it's directly to do with immigration and health.
I didn't get that. It's their being covered that you're concerned about. Thank you.
Yes, it's health coverage.
Thank you for the question. Thank you, Chair. So I will go back to the numbers in a second because I'll ask staff to help me, but it's a good question. The good news here is that the asylum numbers have dropped significantly for 2025. That's good news. And in terms of the health coverage in the budget that we just introduced, there's also some conditions in there where there will be some changes done to that as well for the coverage.
How much has the asylum claimants decreased this year?
Do we have the numbers?
Yeah, so from January to September of this year, 33% fewer people have committed or submitted an asylum claim in Canada compared to last year.
So that 100,000 person increase hopefully is on its way down. Of the 100,000, and I'll put it this way, how many asylum claims were either withdrawn, abandoned, or finalized last year? And of those, what percent were accepted?
Asylum claims?
Asylum claims, yeah.
That would not be, that would be IRB, the Immigration Refugees Board stats. And from what I heard from other testimony in previous, it's all public on their site. My understanding, stand to be corrected,
well,
but it wouldn't be in IRCC when you're talking about claim when you're talking about claims.
So you're not the minister who looks after asylum claims and their adjudication.
On the decisions, yeah, it would be the IRB, the which is an independent body from.
Okay, because I guess my concern is you're covering these folks with the IFHP, but you're not sure what percent of these claimants end up being true or false, basically.
So the interim, Heather, the interim program, it does provide temporary health coverage to address these, urgent and essential needs for refugees and asylum claimants. It's also for refugees as well,
okay,
not just for asylum, right? And refugees
but
are people
the majority are asylum claimants who have not yet been adjudicated. So of these asylum claimants, the 440,000 that we're currently covering with the $900 million that has ballooned, it is my understanding that roughly half, from my purview of the IRB website, roughly half will be found to be not true and not accepted. And the word bogus is used for these. So if we're spending $900 million a year on health coverage for folks, half of whom turn out to be not true refugees. Would you have any plan to recoup these health claims once they're made, if their asylum claim is deemed to be false?
So again, by law, international law, Canadian law, any law you want to look into, we are obligated to cover essential health for people. If we don't, even if the law didn't allow it, if you don't, it's going to obviously, I would say it's going to create a lot more problems for Canadians if people are in urgent need and we don't accept them. So it does reduce pressure later on. What I would say is we do have Bill C-12 on, and I urge you and your colleagues to support it because it will help speed up the process of these hearings. That is one of the reasons why we're doing that.
But fundamentally,
30 seconds.
we're spending hundreds of millions of dollars on health claims for people who are waiting for their their asylum claim to be adjudicated, which is your purview. One thing that was really interesting that this committee was told was that anesthetists throughout Canada are billing 5 times more when they perform a surgery on somebody under the IFHP than under the provincial health programs. My association would recommend, my professional association, the Ontario Medical Association, would recommend that we bill 2.5 times more, but it seems like the sky is the limit. So doctors are billing 5 times more than they otherwise would
Mr.
for these
Strauss,
claimants.
you're going over time. I'm going to have to ask the ministers to answer that question later on. Thank you. I would urge members to remember that the time is 5 minutes for questions and answers, and you know, if you want to pick up that time making a speech, fine, but you may not be able to get the answer. The minister can answer that question later on if someone wants to repeat it.